In this module, we will be studying about the classification of drugs. Drugs are chemicals of lower molecular masses that interact with macromolecular targets and produce a biological response. When the biological response is therapeutic, which means desired and beneficial, these chemicals are called medicines. The use of chemicals for obtaining a therapeutic effect is called chemotherapy. When drugs are taken in safe doses, they act as medicines and are useful in the diagnosis, prevention, and treatment of diseases. However, when the same drugs are consumed in excess, they act as potential poisons. Never take drugs on your own. Always consult a qualified medical practitioner. Drugs can be classified on the basis of their pharmacological effect, drug action, chemical structure, and molecular targets. Drugs classified on the basis of their biological or pharmacological effects are useful in treating a particular type of problem. For example, analgesics have a pain-killing effect, whereas antiseptics kill or arrest the growth of harmful microorganisms. Drugs can also be classified on the basis of their action on a particular biochemical process. For example, antihistamines inhibit the action of the inflammation causing compound histamine. Drugs classified according to their chemical structure share common structural features and often have similar pharmacological activity. For example, all sulfonamides have a common structural feature as shown here. Sulfonamides are antibacterial drugs used to treat bacterial infections. Drugs usually interact with biomolecules such as carbohydrates, lipids, proteins, and nucleic acids. These biomolecules are called drug targets or simply target molecules. Drugs with similar structures have similar mechanisms of action on biomolecular targets. Drugs classified as per their molecular targets are especially used in the treatment of major ailments such as cancers and tumors.